we like to see patients before the surgery so we know exactly what we can take. But those who just want to score a point saying I did 5,000 grafts is not in the best interest. Maybe they will be the last 5,000 grafts they will ever taken on your scalp, because after that everything will be so destroyed and compromised that you won't be able to get another one. Or if you have done 2,500 and we do it over 3 sessions, you may get 7,500 from the same donor that you cannot get more past 5,000 because they have destroyed your donor.
Yeah, and it also is, they may have done 5,000 attempts and scored your skin, your hair 5,000 times, but they may not have 5,000 quality grafts.
What's the transaction rate? That's why they go for this high number, because 5,000 grafts, even when we were doing strip, it was not a small thing. I think beside Hassan and Wang, who was doing those big surgery, not everybody was doing those surgery on a consistent basis. So it requires a lot of expertise. Make sure you don't create necrosis and all that. So if you just take a lot, you run into problem. Especially when people have just average density with a lot of 2 hairs, 1 hair. So if you take a lot, then you deplete the donor. So I think people should not think that because they will use some treatment to enhance donor healing, that they can just do whatever they feel like. And the problem is also a lot of these things, harvesting, are not in the hand of doctors. They are in the hand of technicians or whatever who are doing it. They are not accountable to the patient.
Yeah.
The patient, if they come here, they come at BHR, if they come for Dr. Bisanga or they come for Dr. Kostis, but I am responsible for that patient.
Yeah.
So because I'm responsible for that patient, I took my responsibility to another level. So I have to punch. I have to do it, because they don't come for my technician. I'm sure my technician can do it better than some doctors, but as for me, I keep on telling them, you're not gonna punch here.
It's me.
This is your job. You have a job description, and that's where we draw the line. Some doctor may argue with it, may not be comfortable with it, but I think it's a matter of being honest and open and telling the patient, listen, I'm not going to do your surgery, my technician will do your surgery. I think a lot of people, if they had that information before going to a clinic, most of them will not sign for surgery on that clinic. So it has also to be safe. I don't have any problem with technician. I love my technician. I have my technician, some of them, we've been together for the past 17 years. And so it's almost like a marriage. But, but they don't punch.
Yeah, and I think that's super important for anyone who's going to get a hair transplant. It's so vital to know who's doing what during your surgery. Like, that should be laid out beforehand, and it should be open and transparent. You shouldn't go in to surgery and then the doctor, like you said, say, hey, I know you signed on to have me do your surgery, but the technician's going to do everything and I'm just going to supervise it. You definitely don't want that. You want a clinic, like you said, like BHR, who, Dr. Bisanga is going to do the punches. Dr. Bisanga or Costas is going to do the recipient sites. The technicians will be there to place the grafts or to assist when they need to, do some assistance. But pretty much how the surgery is going to go. I think that is so vital, and that really is the difference between a quality clinic that does the work and a lot of these hair mills where, like you said, they'll do 5,000 grafts. Their goal is just to get the maximum number of patients per day without really any regard for the quality of the result.
Thank you so much for watching our videos, and for more great content, don't forget to hit that subscribe button, and also go to www.bhrclinic.com and start your journey for a free assessment with Dr. Bisanga. Thanks ever so much. Let's get started together and look forward to seeing you soon.